So this first case is near and dear to my heart. This is Oliver. This is a personal horse of mine who I acquired through this series of circumstances. A friend of mine was his veterinarian, and he had an incompletely excised squamous cell carcinoma of his left third eyelid. And so I acquired him. We, continued to treat him, did cisplatin, did some further surgery on him. He ended up having some ulcers that were difficult to manage, so we just enucleated the eye, and he was doing quite well. Externally, things looked, very normal. He was doing great. And then last year, if everyone remembers the polar vortex, those of you in this area, so during the polar vortex, when it was really cold up here in Wisconsin, negative 30 degrees Fahrenheit and ice everywhere, he went acutely blind and became ataxic. So got him in, did a little medical management, did some steroids, got him more stable and comfortable. And then we were able to bring him into the university. He traveled quite well through the trailering and at the university, and we were able to scan him. So you can see here, this was a bit ago for us. So this was actually before we were using the stocks regularly. So we would just walk them up. There was a gate here, and then we had a headstand here where they could put their head. And you can see his blinders are on backwards because he is now blind. And we were just really using them to hold his ears down. And as I said, most horses we would sedate with some acepromazine and some Domator. Because of his neurologic issues, we just sedated him very mildly with xylazine, and he stood great. So we actually scanned him a number of times. So here's the image. So we're starting rostrally and moving caudally. I have some videos and then I have some still images. I think different people like to look at it in different formats. This is going to be his left side. This is his right side. Remember, he had that left-sided squamous cell carcinoma and then the enucleation on that side. So moving back through those caudal cheek teeth, maxillary sinuses, and here's where that orbit would be. And then if you pay attention to this region, you'll see a large soft tissue attenuating mass that's invading the surrounding sinuses. There's a tremendous amount of lysis going through the calvarium into the brain. There we have some still images. So again, that large left-sided mass with a large amount of lysis. Pause that one. So we didn't sample this. I'm presuming that this is that squamous cell carcinoma, just very aggressive. And it's amazing. I'm sorry about the cats. I knew one of these animals was going to make noise. I think it's amazing that he did as well as he did for as long as he did. And if he wasn't my own horse, I probably wouldn't believe the story that he was doing quite well up until the end. I did throw about, 4 articles in here. I know we have some residents on the call. Everybody's busy with board prep. Some other individuals might find these interesting. But this is a paper, VRU 2012. So looking at the CT appearance of equine sinonasal neoplasia. So they had 15 tumors that they looked at. And just a couple of points that I pulled out. They had radiographs on 10 of these horses. And so they were able to compare the radiographs to the CT. They did see the mass in all of the radiographs. And if it was in the caudal or the rostral maxillary sinus, it was typically correctly identified. Interestingly enough, if it was in the sphenopalatine sinus, in the cranium, none of those were identified in those locations. And then in the retrobulbar space, 1 out of the 7 was identified on radiographs compared to CT. Radiographs also tended to underestimate the potential features of malignancy, such as osteolysis or osseous production. So I think it's unfortunate we don't have radiographs on Oliver to compare, but I think this is an interesting paper to think about and really speaks to just how useful CT is in the head As we all know, radiographs can be challenging in that area with a large amount of superimposition, even with taking multiple obliques, multiple images.